You're listening to Hack Your HASCOM. I'm Atanu Das, your host. This is a space where we break down the complex and make it manageable. To get the most out of this show, visit hackyourhascom.com, where you'll find our entire catalog of episodes, show notes, and a place to join the discussion. If you have an idea for a future episode, I want to hear about it. Submit your suggestions directly through the website. Now, let's get to work. Welcome to another episode of Hack Your HASCOM. Today, my guest is Claire Bryant with the National Safety Council. She is a public health professional who works on the Council's workplace well-being initiatives, and she is responsible for planning, implementing, and evaluating programs that address workplace concerns such as substance misuse and fatigue. Her role involves researching relevant topics and providing analysis for technical reports and initiatives to develop future programs. As a certified health education specialist, she creates tools to help employers address substance misuse and other workplace safety risks related to well-being. She develops and promotes holistic interventions that address various forms of workplace impairment, including workplace training programs and impairment detection technology. And before joining the NSC, she worked in clinical quality improvement at Mercy Health Center, a nonprofit health clinic in Athens, Georgia. She also developed injury prevention programs at Atlanta area nonprofits, including the Shepherd Center. Bryant earned her Master of Public Health with a concentration in policy and management and her undergraduate degree in health promotion and behavior from the University of Georgia. Welcome, Claire.
Thanks so much for having me. Excited to talk about this topic area with you.
Yes, we appreciate having you on. So tell us a little bit about the National Safety Council's work and specifically about work related to workplace well-being.
Sure thing. So National Safety Council's been around for quite some time. We're a 100-year-old plus national nonprofit, and workplace safety and roadway safety are really our bread and butter. And over the past 2 decades or so, we've really been investing in the topic of workplace well-being. It's something that we've really recognized as the intersection point between a lot of the work on non-physical risks and how we can be better addressing more comprehensively safety both in the workplace and on the roadway. So our workplace well-being program really started in 2012 with our work on the overdose crisis, something that was obviously heavily impacting our communities, but the workplace is really a microcosm of society. So anything that's happening outside of our metaphorical or our physical walls is going to be happening inside those walls as well. And so we really work to help to address the risk presented by overdose, both in communities and on the job. And that's what started our work within this broader umbrella of well-being. And obviously that's a huge area of different topic areas and risks and considerations related to that word. So we really focus on topics that are most closely associated with negative outcomes on the job associated with injury or risk. Based on the research. And it's a really emerging field. It's harder to research, of course, because we can't always see it with our own 2 eyes on what's going on, underneath the hard hat or behind the scenes in somebody's day-to-day life. But all of the things that we bring to the workplace outside of those, again, physical or metaphorical walls impact the way that we do our work and impact the way that we can be safe on the job. And inversely, the workplace can impact our well-being as well. So we really try and help to make that connection between how our work can really impact our well-being and also how our well-being can impact safety. So we focus on other topics outside of the risk of opioids and overdose, including things like fatigue, mental distress, psychological safety, workplace violence, breaking it down into those physical and non-physical risks that tie into well-being.
Interesting. Well, that's great. So what about recent research telling us about the nexus of this well-being and workplace safety?
Yeah, absolutely. So most of the research that we've been looking at over the last decade or so is really helping to draw that connection that I was alluding to previously, that the more organizations are investing in workplace well-being, the better safety outcomes that you can anticipate. So there's actually a pretty strong correlation between these two areas. really begging us to spend more time to get to some of the root causes that are leading to injuries on the job, which can be in many cases topics like fatigue or substance misuse or forms of impairment that can impact our fitness for duty. So there's more and more research that's going to show that the more that we're doing within our organizations to improve well-being, you can really use that as a leading indicator for safety culture and safety outcomes. So I think I'm excited that there's been more work to really help to articulate this more generally, because again, it's a harder area to research, but the connection is clear that the more that we do, especially if we look at, doing risk assessment with our organizations to see where we have opportunities to do more to get to those root causes and address those root causes, we can see positive returns in our safety metrics as well.
I would imagine, in a typical corporate structure, you have different groups like HR and maybe other uh, interested groups that would want to know more. How do you work together with those in order to first convince them that this is something worth pursuing, right?
Yeah, absolutely. It's a definitely something that you want to spend some time with before you can really jump in to make changes. You want to get a broader collective group to really have conversations deeply about how we can be working to better coordinate all of the systems that we have within our organization to better understand the risks themselves, and also to figure out how we can maybe make some adjustments to the way that we're operating to be more cohesive in the ways that we're collaborating. So breaking down those silos is essential to having those conversations. And one way that you can get buy-in, we actually have some tools at the National Safety Council that are free on our website that show how topics like fatigue and substance misuse and mental health can impact the bottom line of an organization. So impacting things like healthcare utilization, productivity, job turnover and retraining. We've done a lot of research using national surveys to understand how different organizations can expect to see cost metrics change based on the prevalence of these different issues within their organization, based on their industry, where they're located, and how many employees they have. So those tools are on our website, and I think it's a really helpful way to start the conversation, because in some situations, bottom line and dollars and cents end up making a little bit more headway than coming first with the need to do more to improve well-being of employees, unfortunately. But it's all interconnected, and I think that's a great place to start to help maybe turn some light bulbs on.
Great, great. What about the outlook on workplace well-being? Is it changing how some approach the EHS process and their procedures?
Yeah, absolutely. I think more in the last couple of years, EHS professionals are reconsidering how they think about risk. So traditionally, we think about physical risks and physical hazards, which are still incredibly important. We're opening up our eyes to look at those non-physical risks and also psychosocial hazards. And I think that's something that has been really helpful to better understand the whole system of how safety can really impact our organizations and our employees, because we are getting a little bit more deep about the level of data that we're looking at, and how we're considering the human factors in performance, and how that can lead to potential injury or prevent those injuries in the first place. And some of the frameworks that exist to help us do that are things like total worker health, and also human and organizational performance, HOP. Those are systems level frameworks that we can utilize to help us see the bigger picture. So we're not just looking at the individual, we're really looking at the whole context and the way that we are considering risk within our organizations to help make informed decisions, both, focused on the well-being aspects, but also kind of more broadly on how we are conceptualizing our safety management systems overall.
What about what are you seeing as the most pressing topics or issues concerning workplace well-being today?
Sure. So one of the main things that comes to mind for me is something that I'm really passionate about, is the impact of overdose on the job. I don't think a lot of safety professionals always think about overdose being a workplace risk that can
Mhm.
occur. You don't hopefully see it, very often, but actually it leads to about 8% of workplace fatalities is overdose on the job. And so that's something that I think more organizations are looking to at least provide mechanisms like naloxone to have that in their first aid or emergency preparedness plans, to counteract that risk and be prepared for that eventuality, or that potential in their organization. So I think that's something that's first and foremost something that if you don't have naloxone in your organization is something to consider because that risk is there. In addition to looking at fatality data, we've done some other research at NSC to better understand the risk of potential overdose overall. And we looked at a data set, NIMSIS, which tracks EMS-related data. And we have been working to better understand, the impact and the amount of times that first responders have gone to work sites to respond to potential overdoses. And in the last year, we saw that over 12,000 responses to potential overdose, specifically opioid overdose, occurred on the job. So we know that it's happening on job sites, whether that's an actual employee or a contractor or somebody who's even a member of the public that might be interacting with a business that could have an overdose on the job. So that's one thing that I think is important to highlight. And in general, on top of that, it's the risk of impairment on the job. There's a lot of things that can impact our fitness for duty. And I think most people, when you think about impairment, you think about substances that can cause impairment, which of course, makes sense. Whether that's a legal substance or an illegal substance, most substances can impact the way that our body is performing and our brains are performing. But in addition to that, it's also things like fatigue, which most of us have personal experience with times that we're not feeling our best. And sometimes it can be really exacerbated by the workplace itself, especially if you have an organization that utilizes shift work, if you're working odd hours, if you are doing heavy and monotonous work. There's lots of different safety critical industries where the task can actually exacerbate our fatigue, which can lead to higher incidence of injuries or errors. So that's something to be really mindful of, and something, again, that's hard to see. But something that I think when you think about, if you've gotten behind the wheel of your car after a long day, of course, we're not going to be as safe on the road as we would like to be or should be if we're experiencing fatigue. So I think that's a hidden risk that is something that's incredibly important for us to be able to figure out better systems to evaluate and control for that can lead to that impairment. But there's many other factors, that can lead to fitness for duty concerns. Even things like extreme temperatures can impact our performance, and also exposure to hazardous substances can cause impairment on the job. So there's really no shortage of things that can contribute to potential impairment on the job, and it makes it difficult to control for. But it's something that doing risk assessment can help us with, especially knowing the nature of the work that is being done within an organization, to be mindful of that as a non-physical hazard that some organizations aren't necessarily controlling for right now.
Right. What about, other than safety, what other factors might workplace well-being affect at the workplace?
Absolutely. I mean, it's expansive. Well-being is the core of humanity, right? That is what makes us, helps us to live our fullest life, is to have well-being. So of course, we're not expecting safety professionals to help employees, reach, self-fulfillment and self-actualization. But within our organizations, it can also impact costs, like we talked a little bit about already. Within, the ways that we're engaging with our work as well, we can actually lose creativity and productivity when we are not ourselves, at a state of well-being that is our baseline, right? If we're not feeling well, if we're not able to maintain well-being, that can impact the way that we're really able to engage and the way that we're able to bring forth new ideas and to be able to be a productive worker. And also to be able to speak up and share those ideas. Obviously, that goes back to psychological safety as well. And then, of course, the impact of well-being goes to our health and our, the prevalence of chronic conditions surely, obviously skyrockets if we're not doing what we can, both as individuals and within organizations, to help support healthier habits and, healthier systems that we can thrive within.
How can organizations better connect mental health, well-being, and impairment prevention efforts instead of treating them separately?
Yeah, I think there's a lot of things that we can be doing. I think integrating into your safety management system is going to take a lot of work, and it's not always going to be something that can happen overnight. But first things first, when we're looking at the data that we have access to help inform our thought about what those risk areas are that we're prioritizing, we can get creative. So we can look at our EAP data, if you have access to de-identified EAP data, to help draw some parallels to where safety teams, HR, medical teams, operations can come together to dive a little bit more deep into how we are preventing some of these negative outcomes we might be seeing on the EAP side that might also correlate to some of our workplace compensation metrics, for example. We can also be digging deeper when we're doing incident investigation and even JSAs to think about how different incidents or events might have been impacted by something going on, both again underneath the hard hat that might have contributed to that, or but also exacerbated by the workplace. So taking time to ask deep questions about some of the context behind injuries and events and on the work site overall, and then using that data to inform systems level changes that can be integrated within the safety teams and within HR. We've seen some really cool organizations cropping up that take an integrated injury prevention approach, so that they can combine, the injury prevention elements with connection to care at the same time to help triage some of the issues that might be exacerbated by the workplace, such as those psychosocial hazards, and bringing that back and really making systems level change based on that total worker health hierarchy of controls.
What about emerging solutions and innovations? Do you think there are some instrumental solutions that can help shape the future of our workplace well-being?
Absolutely. So I think, of course, reiterating assessment and using tools that exist. I think a good example is the NIOSH Worker WellBQ. It's a really great tool that organizations can utilize to supplement the data that they might already have that can tap into more of the total worker health elements at play within our safety conversations. But also impairment detection technologies is something that I'm incredibly excited about. These are technologies that can detect impairment from multiple causes. So they're cause agnostic, really looking at performance indicators, both from a cognitive and physical perspective, that can help to provide more insight into when a worker might need additional support, whether that's a break, whether that is, a change of accommodation of some kind, depending on the work that they're doing, and really using it as a proactive coaching tool instead of as a blame-based tool. I think it could help us to better understand how we can get ahead of potential injuries in a way that we haven't been able to do before on these different causes of impairment that are so closely tied to worker well-being. And then in addition to that, I think from a broader perspective, we're seeing more standards that are also being drafted and released that help us to better apply a systems-based approach to psychosocial hazards and to mental health and to well-being overall. So ISO 45003 is a great standard that I recommend folks to check out as a starting point to create, programmatic level structure to addressing well-being in the workplace. And we're really looking at other countries that are usually ahead of the curve that, compared to the US on this topic area, such as Canada, Australia, the UK. They've got a lot of great resources and information that we've been able to really learn a lot from. And I think more standards outside of ISO 45003 are examples of what we can be looking at to continue to build frameworks that we can make this a little bit more tangible, because I know this topic area can feel a little bit ambiguous or amorphous sometimes. So I think that's been helpful to really see a lot of these standards that have been created for us to be able to create models for organizations to be able to use to take those steps more directly.
You see us as a U.S. Workplace or industries looking to adapt those standards, or is there still work to be done?
There's definitely still work to be done, but we've seen early adopters that are really, unfortunately, in many cases, have personal experience within, injury or incident data, and in some cases, fatality data that show the broader context on how worker well-being was at play, that negatively, impacted the safety on whatever that day was. And so I think we've definitely heard examples of employers and partners who have been able to implement ISO 45003, for example. It's not a certifiable standard, but it's something that you can use again to create a system and to create tangible change. So certainly have seen organizations grab on to that. But I think it's still new. I think there's a lot of folks who are looking to learn more or looking to also, again, get that buy-in, because it's a harder topic to get, collective you know, input on or agreement on. So I think most of our work right now at NSC is focusing on getting people to pay attention to this topic area as something that's important, and to start small with whatever the risk is that is most relevant to the data that each organization has access to and their risk levels.
Great, great. And of course, with smaller industries, smaller organizations, they don't always have the resources. So, what
Mhm.
can they do to make meaningful progress on well being without those resources?
Yeah, absolutely. Yeah, a smaller organization might not be taking the full steps to implement ISO 45003, for example. But I would highly encourage folks to get trained on mental health first aid as a starting point, so that at least we have skills to be able to recognize potential mental distress, and to be able to have those skills to have effective conversations to link individuals who are experiencing that distress to support. And in many cases, if there's not support within the organization itself, it's becoming familiar with the organizations in your community that can provide support, and really just being a helpful voice in the conversation, to know that somebody is not alone, to know that you're looking out for them, and to be there for them instead of ignoring potential signs of distress. So I think that's a really great place to start. And going back to the impact of overdose, you can also make sure that you have naloxone equipped. In many cases, you can actually get naloxone for free. There's a lot of influx of settlement dollars that have been percolating through our states and communities. And so there's no shortage of opportunities to partner with local harm reduction organizations or health departments to be able to tap into that for free, which varies again by where you are and what's around you. But we've really seen a great amount of partners who are able to supply it to organizations, especially that don't have the same level of resources as some of our larger, higher maturity organizations. So I think those are two great places to start.
And that concept of mental health first aid that you mentioned, what are some examples of that? And are there resources available to find out how to train in that?
Yeah, there's a lot of trainings. This has become a really hot topic over the last couple of years. And you can, I think that the most well known and recognized training is through the National Council on Mental Wellbeing. So if folks want to check out that resource, they have a lot of different types of training that they can administer. It's usually a multi-day training, so sometimes that can be a limitation for folks that can't allow folks to take that much time away from their jobs. So there's lots of micro learning options that have also cropped up as well. But what they really do is to give you a framework to understand, the impact of mental health within our workplace, and also how you can recognize potential signs of distress and then have effective conversations to not be, a therapist or a provider. It's really just to help that person know that there's support available and they're not going through what they're experiencing alone, and to really help them hopefully take the next step with a trained professional, who can take it from there and provide that more deeper level of support. So I think it's a really great way um, to feel confident and gain confidence on speaking up and having the courage to open up with that individual and connect them to care. We also really support reasonable cause trainings that have a similar approach. So looking at not only the impact of substance misuse, but also those other forms of potential impairment on the job, like we discussed, helping supervisors to understand what to look for, and then also the steps to respond to really connect that employee to the next steps in whatever the organization's reasonable suspicion or reasonable cause policy looks like. So really just gaining confidence again to not be afraid to have the conversation and to speak up, and not taking that victim or blame based approach, really thinking about it in terms of compassion, and really helping that individual open up so that we know what's going on. Because a lot of times, if we have policies and programs that are strict in that sense, a lot of things are going to be hidden from an organization, and that's going to negatively impact both the employee and the safety outcomes potentially because of that. So the more that we can have those open conversations without judgment and without blame, the more we're going to uncover from a proactive safety management perspective too.
Does NSC provide that as a service? Like if I were a small organization, could I reach out to you guys and say, help me out here? What can I do? What are my steps?
Yeah,
walk me through the process. Yeah.
absolutely. So we have reasonable cause training. It's our supervisor impairment training that you can access on our site. It's just an hour course that we provide for primarily for supervisors, but employees can also benefit from that information. And then we are launching soon a mental health first aid micro learning course because we've heard that feedback that full mental health certification or mental health first aid certification can be quite a big undertaking, especially if you don't have as much time or as many folks who are able to take time away to complete a training that's lengthier on the lengthier side. And so certainly, that's a resource that we'll have as well. I think in the fall, hopefully.
Oh, great. That's good to hear. Because I think that's a key, as a worker, and I notice things with my coworker, and I may feel hesitant to reach out, right? And
Mhm.
that first step, or is my management going to support me? These things are important to think about, and how do I overcome that? Like you said, because if there is no support, I may feel like, well, I'm just here to do my job, get in my 8 hours, get out, complete my work shift. How do I care for my fellow worker, right? And
Right. And
I
there's a lot of
that
gray area, and it's a difficult conversation to have. I think a lot of topic areas related to well-being are, we're kind of getting warmed up to as a society on talking about them more. So of course, when we're thinking about it from a workplace perspective, we're going to be even more guarded with how we are talking about our mental health or the impact of substance misuse or fatigue on our day-to-day lives. And so I think having a training can really help us understand and have something to lean back to, like with all of our safety trainings on, when something goes awry, how do we respond, quickly and effectively? And this is really the same scope. It's just something that we haven't maybe integrated as proactively as we had in the past of thinking about it in terms of, how it can impact not only that individual, but the safety on the job and also skills that we can bring with us to our families and friends outside of work as well.
Absolutely. Absolutely. So it might have taken this long to start acknowledging the role of well-being on the workplace safety and operational outcomes, because it may not have been as visible as a typical workplace hazard, kind of what we've been talking about.
Mhm.
So what are some ways we can start monitoring well-being like we monitor typical safety risks?
Yeah, I think the WellBQ that I mentioned at NIOSH is a great uh, assessment tool that organizations can consider adding. It is a little bit long, but it is a free assessment tool that you can find on NIOSH's website, and so you can actually administer that at different segments in the year if you don't want to administer it all at once. But I think that's great to have a baseline of some of the data that you can use to better understand where you want to put more resources and thought behind, because of course, you're not going to be able to take all of this and run with it immediately. It's going to take some time. So really spending some time to get the data to inform those decisions will be worth the effort. And also using the data that you might already have access to. This gets back to how we need to get everybody on the same at the same table, from HR to operations to medical, depending on the structure of your organization. But there's probably data that you already have that you can tap into that we might not have been considering from a safety and risk perspective that absolutely applies, that we can tap into to make some of those conversations and planning a little bit more robust than they might have been in the past. And so that includes, like we've talked about, EAP data, that includes pharmacy benefit programs and pharmacy benefit managers, working with them to better understand data that we have access to. Drug testing results are another, if you conduct drug testing at your organization, that we can use to inform decision making. And then also our incident investigation process and asking some of those deeper questions, like we talked about before as well, and being thoughtful about that when we can. We have to be very mindful of HIPAA and of other laws and regulations that exist. So being thoughtful about how we're partnering with legal teams about what questions we're asking is very important. But just broadening some of that scope, I think overall will help us to be more informed.
Great, great. And for the EHS professionals that are in our audience today, what would you recommend they do to start better addressing this factor that's critical for all organizations?
Yeah, I think just like any other risk, when we're starting a new program and we're using our PDCA process, so starting with the planning part of your process before you get to the plan, do, check, act, just like we do for the rest of our risks, considering how well-being can fit into that process, and starting from there and getting the buy-in, like we talked about earlier as well, to make sure that you have everybody at the table to make those decisions to move forward. We have a tool on our website, the Workplace Wellbeing Hub, and that is really our central warehouse of action-oriented tools for safety professionals on addressing well-being related risks. So that's certainly, once you've had those conversations with your organization, once you've done risk assessment, you can go to our Wellbeing Hub and use the tools that are there to help actually implement programs and systems depending on where you're looking to start first, whether that's, focusing on addressing substance misuse and starting with naloxone, or building programs related to addressing the impact of mental distress on the job or kind of broader psychosocial hazards or fatigue. We really try and put everything in one place because a lot of these different topic areas have similar controls and similar interventions that can impact many of these areas all at once. So we've created a lot of those resources for free so that it's easier for organizations to, once they've identified where they want to start, they can build in a policy or they can build in a benefit structure partnering with HR. They can also better understand what data to look for to help really build continuous improvement on their initiatives. And also links to research that we've conducted on how all of these different topic areas really fit into the safety conversation as well.
And what I like to do with our guests is, what's one takeaway you'd like to give and pass along to our audience today?
Yeah, I think it's really just to consider how we can be getting a little bit deeper to address these contributing factors that can lead to injuries on the job. And a lot of times that is the topic area of being and thinking about how these different factors can influence safety. So really just spending some time to think about how you can have this conversation internally. So what does that look like for you, and how can you pose this to your leadership or to other partners within your organization that are champions for safety, and thinking about well-being as a leading indicator for safety culture. I think that's the most important place to start.
Excellent. Well, thanks again, Claire. And for more information about Claire, visit the HackYourHasCom.com website, where you'll have the ability to find more ways to contact her. I'm sure she'd be willing and able to answer all of your questions and get you started on this very critical topic. So thank you again, Claire. It's been a great conversation.
Thanks so much. Appreciate you having me.